Hello and a very warm welcome to ET Healthworld. Now here's the thing, when we talk about healthcare, we often focus on doctors, hospitals and technology separately. But the real challenge perhaps is how all of it comes together to deliver the right care at the right time for every patient. Now that's exactly what we are diving into today with two fantastic guests. Please join me in welcoming Cella, Vice President and General Manager Health International at Wolters Kluwer, and Ruchi Tushir, Vice President and General Manager, Wolters Kluwer, India. Now, between them, they bring a global perspective and a local lens on how knowledge, innovation, and even AI are reshaping healthcare in India. From easing the pressure on clinicians to making sure patients, whether in a metro or a small town, get the best evidence-based care, we've got a lot to cover. Well, thank you both for joining us for this conversation. And I'll start with you, Christian. First of all, welcome to India. We're glad to have you here. And starting with my first question, we often talk about the global healthcare trends. And with your experience across APAC region, what are those challenges? Like, I'm curious to know that what are those challenges you see are reshaping the healthcare industry? And especially if we focus from the India lens.
Yeah, no, thanks, Imanshi. This is a very good question. And first of all, it's always a great pleasure to be here in India. So it happens that I'm in APAC tour. So I've recently visited countries such as Vietnam and China. And it's fascinating how there is a common universal demand for world-class care. But also how it's difficult both for public and private health system to deliver it. Yeah. And this is due to common trends that we are seeing around the globe. But first of all is the clinician burnout. So more and more clinicians are suffering burnout. We are calling the second wave of COVID in a sense, because after that they are under big pressure and more clinical documentation. It happens to be happening for them to work with. The second big trend is related to variability of care. So there is a big difference on how you're treated depending on the hospital or the outpatient point of care you are going. And these trends are even more visible sometimes in India, where we do see that the best doctors sometimes are leaving the country. So there are some astonishing statistics that we have observed in the recent year. If I'm not wrong, there are 76,000 Indian doctors that are working in the OECD, okay. And 22% of the physicians in the United States are coming of an immigrant physician are coming from India. So these put an additional pressure on the healthcare delivery in India, because the ones that are staying and they're very well prepared, because India is preparing probably the best doctor in the world, are really facing even more this challenging of pressure, time efficiency, having to visit a patient in a very short time lapse. Mm-hmm. And so what does it mean for this challenging to be addressed? There is a high need to help them to perform their daily work in the best way possible, providing to them the best knowledge, the best evidence-based medicine, okay. And within the workflow, so at finger points, because they need to really become more efficient with the right tool to provide the best care to patients.
Yeah. No, thank you for sharing that. And perhaps we'll come to the right tool part as well in the later part of the conversation. But before that, Ruchi, any thoughts? Do you want to add something?
First of all, hi, Himanshi, nice to meet you. And I think I couldn't agree more with Christian. The core issue truly here is about creating an ecosystem which is of excellence and opportunity both. And I think this is not just about a point, but this is about the entire ecosystem. And the healthcare providers, the government, the healthcare solution providers all need to come together to create that ecosystem of excellence. Yeah. And I think that's where we fit in as an organization, Wolters Kluwer, which takes immense pride in serving the entire ecosystem in one way or the other. And if I have to elaborate a bit more on it, essentially we're talking about this ecosystem getting started when the students enter the education of medical science. Yeah. From there on, they move on to research, gaining excellence on a particular medicine topic, going deeper with post-graduation, and then subsequently getting into the ecosystem to serve the patients. Yeah. And we take immense pride in how we are actually playing a part in the entire spectrum of that ecosystem. We start off by when the students are getting into medicine and understanding how we can provide them content that's most logical, it's most relevant to the curriculum, and at the same time top it up with technology and AI that can make learning programs relevant to their style and approach. It doesn't stop there. We move on to actually supporting our this ecosystem by providing solutions in the research spectrum too. And we're talking about large numbers. Christian already spoke about the volume of good quality doctors that we are producing. Now imagine if there aren't any tools or support to create that ecosystem into a well-researched research outcomes. Yeah. We're not taking the strength to the world. And hence we again play a very strong part with our solutions in the research space. Moving on, when this entire pool of doctors are entering into healthcare system, we come in with our CDSS. Again, a very strong evidence-backed solution, which is helping drive the right patient outcomes. So I strongly believe that this is about all these elements coming together and playing a part to create that ecosystem of excellence.
No, thank you so much for sharing that, and I'll move further to my discussion, wherein I will perhaps like to bring AI into the discussion, because no conversation at this point in time is complete without talking about AI, right? Everyone is talking about AI, and Christian, if you can come in at this point in time, if we talk about AI, especially generative AI, how do you see generative AI sort of changing the healthcare both globally and also in India? And also, most importantly, what are those areas that we need to be careful of while adopting it as well?
Yeah. Evidently, AI is the new force in the health ecosystem. So it's really reshaping the industry top down and bottom up. We do see application of it around the full ecosystem in health, from reimbursement to radiology, to all the spectrum up to the clinical decision support. In India, this can really have an amplified impact for two reasons, the size of the country, but also your leapfrog often in technology. So government initiative like Ayushman Bharat Digital Mission really have the potential to move India healthcare system to the next level. We do see application that are, I would say, more straightforward. And you were talking about generative AI, but also in agentic AI. So tasks that are less patient outcome facing, like reimbursement, can, I would say, are already in the process to be more streamlined and efficiency and increasing efficiency through AI. There are areas that I would say are in between, like radiology, in which evidently this is amplifying the doctor capacity to detect potential diseases. When it's becoming more sensitive and where there is more risk is in the clinical decision support. So we are super excited about how technology and AI, generative AI and agentic AI can help clinical decision support to be more impactful, but there is a big but, because there are risks.
No, absolutely. That's the potential we are seeing when it comes to AI, Christian. But as we know that AI is everywhere, and we have seen a lot of news reports where patients are actually turning to chatbots for medical advices, right? And there is not just one instance, there are multiple instances. So in a clinical setting, if we talk about what are those real risks, and how do we sort of ensure that the technology is used responsibly? Of course, we know the potential, but where we draw the line?
Yeah, no, I think this is really at the core of our value on how we want to evolve clinical decision support solution. There is a patient life at stake, so this needs to be taken very, very seriously. So as you were mentioning, we do see more and more patients going to AI chatbot to ask about their treatment, their diagnosis, and it's not a big news, it's just an amplified effect from what was called in the past Dr. Google, but we do also see clinicians going to this type of resources that are open source resources. So they are retrieving all the information that is on the web. And we all know that all the information in the web can be really can be contradictory, can be biased, can be false. So here is where we are really taking our what we call responsible approach, and we are working really on several variables. The first one is that we are developing what we call UpToDate AI based on our UpToDate core content. So it's a closed content, which is our evidence-based medicine database that is highly curated by 7,000 doctors around the globe each day. That is the source to help the clinician to have a quicker and better answer to them. The second part is related to how it's the answer provided to the clinician that is asking the question. We do know that prompting a question can provide, how the prompt is set up can provide a very different answer. So even just if you turn a couple of words, the answer can be totally different. And if you don't prompt precisely, you can put at risk, again, the patient. Can you imagine if you don't say in the prompt, how can I treat a disease for a pregnant woman versus non-pregnant? The impact on the dosing, the drugs, it's totally different. So we provide a clear answer to any prompt about, did I understand well? These are the right assumptions. And this is what we call responsible AI. So put in the right guardrails, put in the right transparency to give the right answer.
All right, thank you. And Ruchi, if we can come to this discussion, as he said, that responsible AI is all about the trustworthiness, giving clinicians the trustworthy, those explainable insights. But how does it tie to the entire clinical decision support system? And why do you think perhaps this is the right time for India to enter?
I think while I was listening to what Christian was describing about our approach to AI, I do want to re-emphasize that we take pride in taking responsible AI approach. And truly, it's built with taking the clinician community along with us to provide solutions that are most logical for healthcare community. Now, coming back to your specific question on why CDSS is now right for India, I think this is the time when we need to, deploy clinical decision support system and take the journey much forward for India in the digital health space. We're essentially talking about, we've heard about EMRs being the new standards and new norms for how they should be implemented in the country. Well, that's a great starting point. And it also ensures that, there's a large volume of data sets that's being collected. That's great, but it doesn't stop there. The next logical step is for us to start using evidence-based solution which can impact the decision making. We want to take these data insights to the bedside in a hospital. It should be available to a clinician when he or she needs to take the decision that will change the course of patient's journey in the hospital or provide right patient outcomes. And that's where we feel this is the right time. We are on a digital health mission, and what better than providing tools and ecosystem which can make the life of a clinician a lot more easy by giving them evidence-backed decision-making trees, which can help the patient care completely.
All right. Thank you so much for sharing that, perhaps it was important for me to talk about responsible AI before diving into what tools and ecosystem do we really have. And Christian, you were talking about UpToDate. I didn't realize it was that powerful, perhaps. I always thought of it more as a web page or a reference for doctors. But if you can explain how it helps the clinicians in real time, it would be great.
Yeah, Ruchi was already explaining that it helps doctors to take the right decision when they have a clinical question. And, when we started this journey 30 years ago, there was a statistic that 1 out of 8 times the doctors really don't know the answer to a clinical question. And so we have started from there. Now, I think there are 2 big impacts that UpToDate can generate and not be considered as a web-based product. We have in India more than already now 11 million of views per year and 800 million around the globe. So can you imagine the richness of data insight that we have about what doctors are looking for? We have been able to detect in some country infectious disease spike before the public health organization and discuss with them about that. We can help health system, both public and private, to really detect where the clinician have gaps in knowledge that needs to be fixed to prevent variability of care and health there. So we are also launching right now, based on that, in APAC, what we call the UpToDate Enterprise Edition. So this is specifically dedicated to complex large health systems, both public and private, to deliver not just the answer to the end users, the clinician, but also to the C-level, this clinical insight about their health ecosystem and be able to compare even different sites within their hospital settings.
All right, thank you for sort of explaining that in detail. And there's one question, perhaps Ruchi, if you can get into the conversation, which comes to my mind and of course to a lot of people's mind, that when we talk about AI, there's a common fear that technology and also AI will perhaps take the humanity out of healthcare, right? That it will turn care into just data numbers. What are your thoughts on it?
Well, this is a very important question, and we clearly know how much impact is AI making into our daily lives. But our philosophy is very, very simple. We treat technology as something which is going to give clinicians more time for their patients, period. And I think in his opening statement, Christian did talk about how clinicians are very time poor. And now put this situation for India as a market, where our patient to doctor ratios are skewed. We have a huge influx of patients who need to be treated the right way. Now imagine with technology's use, we can actually give more time back to the doctor to listen more to the patients, understand their situation, and then take support of a technology which can help them arrive at the right decision. So this is truly working in the direction of not just automating, but probably solving the biggest problem of giving proper care by listening into the patients, understanding the care path, and truly being more humane about it. See, behind every data point, in the end, there is a person.
Yeah.
And I think with this technology introduction, the AI on top of it is only going to help it make better. And we strongly believe that, by implementing this, we're able to bring in more compassion, more time for patient, and the right outcomes for subsequently the patient himself or herself. And this is how I strongly believe we're going to make an ecosystem of digital health in India together. And that's our dream to take it forward in the country.
Absolutely. What I have understood is that by giving more time and by giving better knowledge, we can perhaps look at delivering the best care, and we can perhaps get more time to be human, right? And AI is, now that you have explained, is not going to take away jobs, not going to take that care from the healthcare. That will remain the foundation. It will perhaps empower us, right?
And if I may just add one statistics that's been really working well for us, and we're very proud of it too. I think the users who are leveraging UpToDate to make their practice a lot better, almost 95% of those clinicians trust UpToDate. It's a huge number. And similarly, 93% of those clinicians have already called out that it has improved their quality of care that they provide to the patients. Now think of it. With technology, with compassion, all of this is only making the healthcare better.
Yeah.
So what better spot than this to really take it to the market?
Yeah. And there's one line that ties everything that you both said is written right there: deep impact when it matters most.
Yes.
And I would like to end the conversation at this point in time. Well, thank you so much for giving your time and sharing about the tools in the ecosystem and how we can sort of reshape the healthcare with the new technology and AI that's coming in. Thank you so much. And to our viewers, stay tuned for many more such insightful conversations only at ET Healthworld.